welcome back, everybody, to another episode of the Nonprofit Show. I'm really excited about this episode. I think I say that every day, but it's like children. You have your favorites, and I'm just going to say, I'm going to call it out.
It's authentic.
I know it is. But we were talking in the green room with Jared Walker, our guest, the founder for at $4. And Sherry, don't you and I talk about leadership a lot? I mean, no matter what the topic is, it always seems like it comes back to leadership.
Yeah, I think it comes up in every episode in some way, shape, or form. So excited to kind of give it the spotlight today.
I think so. Jared Walker, what a delight to have you on. Any founder is a friend of mine because it's so hard. And we're going to be talking about your really interesting work in the medical debt space and how you've really created a national movement. So we are just delighted to welcome you to the Nonprofit Show, as we are delighted to welcome our presenting sponsors each and every day. They include Bloomerang, American Nonprofit Academy, Staffing Boutique, JMT Consulting, Interim Executives Academy, Your Part-Time Controller, and Fundraisers Friday. I'm Julia C. Patrick, CEO of the American Nonprofit Academy, but more importantly, I am joined by Sherry Quam-Taylor, CEO of Quam-Taylor, one of my faves.
Thank you. Glad to be with you today.
Yeah, it's going to be a lot of fun having this conversation. So Jared Walker, a founder. This is remarkable. It takes a lot of guts, a lot of perseverance, and you're working in a tough space, medical debt. Talk to us about what $4 does.
Yeah, thank you so much for having me. $4 is a nonprofit, and we help people with hospital bills specifically. So we are enforcing hospital financial assistance policies, which are policies that a lot of people have no idea exist. So most hospitals, and especially nonprofit hospitals, are going to have these policies and are actually legally required to have these policies that reduce or completely eliminate hospital bills for people within certain income ranges. So we enforce those policies and help patients with their hospital bills. So we've been able to eliminate about $88 million of medical debt for people throughout the country by doing this.
Wow. Amazing. Now, talk to us about how this originated, in that you said this is a requirement for nonprofit hospitals. Is it also a partial requirement for for-profit hospitals?
So there's a law that requires nonprofit hospitals. It is in the Affordable Care Act that requires hospitals. So basically it's like, hey, you are tax exempt. In exchange, you're going to provide community benefit and charity care. For-profit hospitals, there is not that legal requirement, but they still, most all of them do it.
And Jared, for clarification, is a nonprofit hospital like a FQHC, like a federally qualified, or is that's a whole nother category?
Yeah, so a whole other category. So nonprofit hospitals, I believe last time I looked, 65% of all hospitals in America are nonprofit organizations. So a lot of the religious affiliated hospitals, honestly, most hospitals are nonprofit.
Okay.
Yeah, really interesting. And so charitable medical care, not a new concept, but this structure that has been legally defined and structured up is relatively new, right?
So yeah, I mean, it went into effect with the Affordable Care Act. There are some states that had state laws that predated that. But yeah, it is, I mean, as I would say, Affordable Care Act was 2010, something like that. So it is like not super new, but people knowing about it is new, I would say.
Things move slowly in the medical arena.
Definitely.
Yeah, really interesting. Well, let's talk about this leadership journey and, how you got involved and how you took a leadership role in deciding you're going to pursue this.
Yeah, I mean, it was, I think I've been called, the unlikely founder, the accidental founder, many, many times. I had no intention of doing this work. I had no intention of starting a nonprofit. My wife and I were sitting at home. This was in 2012. So I'm in the Pacific Northwest, grew up in Portland, Oregon, and we got a phone call, and her aunt had passed away from cancer. A couple minutes later, I got a phone call. My cousin had gone into labor 7 weeks premature. Baby needed a heart surgery to live. And same day, same hour, both families were hit with these medical emergencies. And I remember a lot of the conversations were like, well, how much is this going to cost? What are we gonna pay for it? And that really, really frustrated me, knowing that in America, a lot of times when you have a medical emergency, a lot of times you have a financial emergency. And that really frustrated me. So I set out to try and help people hopefully avoid the financial burden that comes with a medical crisis. So I actually started Dollar for Portland, and it was a crowdfunding platform to help people pay medical bills. Oh. So I spent years like doing small grassroots organizing, coffee shops, breweries, music venues, kind of stuff where we're pooling the money together and paying medical bills. And then years later, I found out about hospital charity care and financial assistance and realized I had been paying medical bills for low-income families that all would have been eligible for these programs.
Wow. These are the things you just don't know until you dive deep. I mean, like I'm like, you're educating me on all this, which only makes sense, right?
Mm-hmm. It is. I mean, I would say most people leave the hospital without any knowledge of these programs. Mm-hmm. It is, completely, I would say, the best kept secret in healthcare. And it's, I would say also like the lowest hanging fruit to help people. Most people, are creating GoFundMes. And, I think 36% of all GoFundMes are American healthcare costs. I mean, it's wild. So it's something that is just right there that hospitals don't do a great job of telling people about.
Yeah. It's fascinating because, when you hear that phrase, sometimes it's horrible, best kept secret, that you don't want this to be a secret. And, and it's just an absolutely fascinating thing that I would imagine a lot of folks have no idea about, even in the nonprofit sector, even when we're working with, the working poor or people forced into becoming the working poor because of medical debt. It's a frightening thing.
Yeah. And I mean, I think we've probably all seen that stat of, 54% of Americans can't afford a $500 emergency. It's like, well, what is that emergency? A lot of times it's a medical emergency. It's a hospital bill, in an ambulance ride, whatever it is. And a lot of people, I mean, even I talk to a lot of healthcare workers, doctors, nurses, and even telling them, they're like, I had no idea that my hospital is offering this. So yeah, it's definitely something. I mean, our mission is to make charity care known, easy, and fair. And known is a big part of that, right? We gotta get the word out.
And how do you go about educating such a giant system or, like behemoth concept?
Yeah, well, for us, I was doing this work, because I found out about these programs. I talked to an attorney at like a networking event, and he was like, "Oh, have you ever heard of these charity care programs?" And I'm kind of thinking, I would have known about this, right? Like, there's no way, there's no way that this is a thing. So I start helping people in Portland, Oregon, fill out the paperwork, and I just start diving into the policies and looking through the applications, and they don't make it easy. Like the applications and the whole process is difficult. So I start doing that, and I get a call from one of these patients saying, my $8,000 medical bill is gone. Like, I don't know what happened. So I am like, oh my gosh, I think that this works. This works.
Ding, ding, ding.
So I am trying to get the word out and just not having great success talking to journalists and news stations and whatever. A lot of people didn't want to run the story. And luckily, I got on TikTok. So I posted a 60-second TikTok video. It was my first video ever. I had 0 followers. And the video ended up getting like 30 million views. So that was how I originally started telling people about charity care, was TikTok.
TikTok. I'll stop saying bad things about like my daughter on TikTok now.
It's mostly bad, but I will say there are some good that can come from these social media sites.
Good for you.
I love this storyline because it's very organic, it's very honest, and it's incredibly powerful,
Mhm.
especially when you come up against the healthcare system in our country, which is, to use Sherry's word, a behemoth. I mean, just such a massive structure to work with, work against, work for. I mean,
Mhm.
really interesting. So you're moving forward with something that is somewhat controversial. The Affordable Care Act is still um, being challenged. It seems like every other week there's something coming up against it. And you're growing your mission. You're talking about this. You've moved outside of your community locally and moved to a more of a national movement. How do you do all this amazing growth and this outreach and still stay connected to the mission and what you have to do? Because I think in terms of leadership, a lot of times there's that moment where you are a different type of leader.
Mhm. I early on, like when the whole TikTok thing happened, $4 was just me, and we grew very quickly from that. And now we're a staff of about 18, and nationwide impact. So at the beginning, we were talking about like what are the values of $4? Like, what are the core values? What do we want to be about? And one of the things, one of our core values is celebration. And every single time we get a medical bill waived, we have a Slack channel that automatically posts, a quote from the patient, the amount of medical debt, the hospital that it was relieved, and like it's a little mini party, in our like in our staff, because we want to stay connected to the stories. We want to stay connected to the impact, because it's like this is why we're doing it. So I think that was a really important decision early on, is to be like, hey, $88 million of medical debt is a lot. And each one of those hospital bills represents like an actual person that we were able to impact. And that person might have been able to continue their education, pay their rent, put food on the table, buy a house. Like, these are real impactful stories, and I want to be reminded of that constantly.
Mhm.
So I think that was, something that I would say was pretty important, and is still important in like staying connected to the mission.
Yeah, and I feel like, influencing generations, like, just to have that release of, like, that pressure, I can't even imagine such carrying the weight of a giant bill,
Mhm.
and weighing like, "Oh, can I pay my kids' tuition versus this?" I mean, life-changing.
Yeah, I mean, it is very much the tip of the iceberg, right? Is that like medical debt? Up beneath that, you see all of the things I mentioned. We have people that say, hey, I was able to graduate. I was able to continue my education. I was able
Mm.
to pay rent. I was able to keep my job, like all of the things. So, yeah, it is definitely, there are long-term impacts, and even just mental health improved, right? I mean, the stress
Yeah.
of these bills is a huge deal.
Yeah.
Huge, huge.
Well,
Yeah.
yeah, I would imagine too that it changes the perspective of empowerment and working within a community and taking that victimization piece away, which is
Mhm.
pretty powerful, right?
Yeah, and I would even add to that is like trust in the healthcare
Mhm.
system. I
Yeah.
mean, 1 out of 4 patients are just avoiding care because of the cost. So they are just neglecting the care that they need because they know it's going to be too expensive. And when we have people say, "Hey, I've been fearful of even going to the hospital, and now I feel more comfortable doing that," that's a pretty big deal. I mean, because a lot of times people wait too long until the issues get worse and worse, and they become more expensive or even life-threatening.
Right. Really interesting. Okay, so then talk to us a little bit about this massive growth that you've incurred. You're talking about patients. You've got some HIPAA issues. You've got privacy things. It's not just as easy as telling a good story, right? When you're talking about anything medical.
Mhm.
And then you've got this data. How are you seeing this influence the discussion?
Yeah, what one thing that we did at the beginning, so a part of that TikTok video, I told people, if you need help, just shoot me a message, right? So I have tens of thousands of messages coming in from patients saying, hey, can you help me with my hospital bill? So the first big project at $4 was creating a database of every single hospital in the country and capturing their financial assistance policy data, because unfortunately, this is not standardized. Every single hospital has its own policy, its own income threshold, its own eligibility criteria, and there are about 8,000 of them. So we had to go through and read all the policies and capture that data so that a patient can very quickly put in their household size, their income, what hospital, and it will tell them immediately if they're eligible at that hospital. So that is like our first big project, and it was a data project, right? And we have seen, we have had foundations and policy groups reach out and say, hey, like, how do our hospitals stack up against the other hospitals in the area? Or like being able to just show a snapshot of like, these are all the hospitals and this is how generous they are versus, the neighboring state or whatever it may be. So we've been able to kind of act as like a watchdog as well on like which hospitals are doing this well, which hospitals are not doing this so well. So there's that, which I think is really important. And I think there's also, why are patients reaching out to $4? Like what type of medical bills, right? And yeah, you're right. We have a lot of privacy issues. Like we have some pretty robust security, protocols at $4, but it's like, and we're not really asking like, well, give me all the medical history or anything like that. But people do, as an optional question, we ask them like, what is the bill related to? Number one, cancer related. Number two is childbirth. So this is why people are reaching out to $4. This is why people are getting these hospital bills. So there's a lot of, we could talk a long time about the data and the patient stories and what we're seeing. But you can see how a lot of that information is very helpful, because now it's like, okay, well, maybe we need to target, new families, young families, new moms. Like maybe we need to target this this area. We translated all of our forms and everything into Spanish because we knew that there was a huge need with that. So, there's a lot there.
Yeah.
Wow. I'm sitting here thinking of the people I'm going to forward this to afterward who are doing, related work, but not the same course of, leaders I work with who are coming alongside mothers who had a preemie or, like a huge medical bill from childbirth, where now it's like, whoa. And maybe they are providing, example she's given me is like Ubers for like, the mom to come to like all of those kind of outside supports, but like I can imagine the inside medical bill that maybe they're dealing with. So I'm excited to forward this to people as you're talking.
I appreciate it. Yeah, no, think about all of the partner organizations, diaper banks. It's like, there's so many organizations that, and we already have a lot, but we would love to build our partnership portfolio of where all of these organizations that are helping, there's a lot of overlap, and they can be referring all of these people to say, hey, you might have a hospital bill from that. Here's an organization that can help.
So good.
So interesting. And I think it's fascinating that, even to be talking with medical professionals within an institution and not having them know about this process.
Yeah.
It's shocking, but yet it's not, right? It kind of makes sense that this might be something that is not clearly promoted, shall we say. And so, we don't have a lot of time left. And as we were kicking this episode off, talking about leadership, Sherry and I, again, we talk about this between one another. We talk about it with our clients in our communities. What do you see as the future of your leadership in 10 years? You went from a guy with an idea on TikTok to now almost 20 employees in a really short period of time. What does the next 10 years look like to you?
Oh, man, that's tough.
It is.
The ball.
I hope that $4 does not have to exist in 10 years. I hope that, what we are trying to do is we are trying to influence policy to require hospitals to screen patients for these programs before they send the bill. So that would be a game changer for people, with these hospital bills. I think that the idea that we need a nonprofit organization to come in and basically become the charity care customer service line for these hospitals is embarrassing. Like these hospitals should be doing this. And so I hope that we can make significant strides towards that because $4 should not have to exist. And after that, I'm very passionate about when $4 kind of at the beginning of 2021, when we had that TikTok moment and we exploded, I was, I guess, nominated into a couple of these like nonprofit accelerator programs. And I was able to find a community of like startup founders in the nonprofit space. And I'm very passionate about that group. Like, it is very hard to start a nonprofit. It's hard to start anything, but a nonprofit is pretty brutal at times. Yeah. And I would love to have some connection to young founders, people that are inspired by an idea or want to, see change in the world and trying to figure out how can I get started. I think that, back to that, like the unlikely founder, I think that the $4 story is really relatable. And it's like, if this guy can do it, maybe I can do it. So I think that, that hopefully $4 doesn't exist, and maybe I can help some other founders along the way.
Yeah. Jared, I'd be curious to know how you're funded. Like, who's the donor that gets this? Just out of curiosity, because I always say fundraising is education, and like you're educating all of us what the problem is, why it exists, why you have to be in the role that you're in. I'm just curious how you're funded.
Yeah, so far 100% through philanthropy and donations. So we do not have like a revenue model. We're not charging patients for our services, anything like that. It's interesting because $4 actually doesn't fall within like, we're not like a healthcare organization, right? We're more of like an economic mobility, economic opportunity organization. So there's a lot of funders in that space. We've had people like Reid Hoffman that have been generous donors of $4. We've had a decent amount of success in like the tech space, like the San Francisco Bay Area tech people that get it, because like $4 has been able to turn every dollar donated into a little over $20 of medical debt relief, and I think that return on impact is important to a lot of those donors. So that's been an area, and then just like a handful of the smaller family foundations as well. But anybody that's going to have economic mobility, economic opportunity, poverty alleviation, that's kind of where we fit.
Wow, incredible.
Sherry, I'm so glad you asked that question, because I was thinking the exact same thing. Like, how do you go out and sell this idea to a philanthropic investor to get them on board and to have them really support you and navigate that forward? Has this been a hard sell for you? I'm assuming you're the one that has to go out and really share this mission and this concept, because it's so new and so different.
Yeah, I have had to step into that. It's so funny because like I started as the patient advocate. I was helping patients do this, and my role has changed many a time through this process. And now it is, I'm fundraising most of the time. So is it a hard sell? I think that philanthropy is very difficult. There's a lot of people competing for the same, dollars. And I think $4 sticks out pretty good in the sense of like our return on impact. We can do a lot with a little. And I think where it gets difficult is we also are bringing on this policy play. So we're a direct service organization. We're doing direct service, but it turns out the more patients we help, the more data we collect, the better position we are to push policy forward. And I think that it's hard to find like the perfect donor that is really, really excited about direct service work, but also really, really excited about, the policy. Because some organizations just say, oh, we don't do any type of policy. Or their organizations say, oh, we don't do any type of direct service. So you're trying to find, the people that are passionate about both, and trying to stay away from, restricted funds. We have people that say, I love what you're doing, but I only want you to eliminate medical debt in California. And it's like, okay, well, that's great. We can do that, but we're going to eliminate medical debt anywhere, right?
Yeah.
So it's fundraising's hard.
It is. You're one of those people who are like, I don't believe I'm a fundraiser after all of this, but I feel like this is one of those, like I had a coach that said like the riches are in the niches. And like, I'm like, this is the niche and you have the ability to attract investment level donors who get it and want like root sustainable change. So I'm cheering you on. This is awesome.
Thank you so much.
Yeah, really interesting. I think that, it's such a bold move to become a founder of a nonprofit. And unfortunately, so often it's driven by a personal experience. And then you have to fill in all the blanks. You have to fill in all the, you have to create your own training and figure out what it is you don't know so that you can learn it, right? I mean, it's really arduous. And so we really are excited to have had you on the Nonprofit Show to talk about this. Thank you very much.
Thank you so much for having me. I appreciate it.
It's been really fun. I mean, again, leadership is such a delicate thing. It's such an ephemeral issue. And yet it is the difference between success and lack of impact. And so Jared Walker, founder Dollar4, check out dollar4.org and you can learn about their work, their journey, what they do. Sherry, you said something really special, and that is there's so many of our nonprofit partners that would be such a great stakeholder in this to understand how to use this, how to navigate these relationships. I just love it.
Yeah, I've got lots of questions and watch for an email from me, Jared.
I look forward to it. Yeah. And if you have a hospital bill, dollar4.org, the screener's right there. It is free. We might be able to help.
Awesome.
I love it. Well, this has been magical. Thank you for the work you do across our country. We know this is a huge issue, and it's just so frustrating for so many of us to be watching it or experiencing it. And super neat to know that there's somebody like you and your team out there working on this for all of us. And so, Jared Walker, what a delight to have had you on the Nonprofit Show. It's also a delight are these amazing partners that we have that are our presenting sponsors. They include Bloomerang, American Nonprofit Academy, Staffing Boutique, JMT Consulting, Interim Executives Academy, Your Part-Time Controller, and Fundraisers Friday. We've had a lot of comments that have come in, and I love this one that just popped up on my screen, and it's like, awesome to know. Thank you. So this is cool. I really, really appreciate it. Wow. Okay, Sherry, I have work to do because I'm going to be making some connections.
Yes.
I love it. Well, as we end each and every episode, we like to remind everyone of this message. And today it really resonates with me because the message is this: to stay well so you can do well. Thanks, everyone. We'll see you here again.